Hi friends, welcome to our YouTube channel NESAP. Hope all are doing well. Today we will discuss some questions regarding digestive system. Before that, please like, share and subscribe this channel for more nursing related videos. Okay, we will begin our class. First question, Stensteken Blakemore tube used in option A, GI bleeding, option B, upper GI bleeding, option C, lower GI bleeding, option D, respiratory tract bleeding. Correct answer is option B, upper GI bleeding. So what do you mean by Stensteken Blakemore tube? These are the tubes usually we are using to suppress upper GI bleeding, especially esophageal varices. This is the picture of Stensteken Blakemore tube. You can see there are three ports. One is for gastric balloon port and esophageal balloon port. The other one, middle one, is for the gastric aspiration port. Then there are two balloons, esophageal balloon and gastric balloon. The esophageal balloon will suppress the bleeding from esophageal varices and the other gastric balloon places the tube in the stomach correctly. So through this gastric aspiration port, they will aspirate the content. Next question. Pancreas arises from which embryonic layer? Mesoderm, endoderm, ectoderm and mesendoderm. Correct answer is option B, endoderm. The endoderm becomes the lining of the digestive system and the respiratory system, and it forms organs like liver and pancreas. Next, Brunner's gland present in stomach, esophagus, ileum, duodenum. Correct answer is option D, duodenum. So the duodenum has some specific glands named Brunner's gland. It will produce some alkaline based mucus which helps the duodenum to protect itself from the acid secreted from the stomach. Next, passage of blood is stool where the blood appears fresh and red to maroon in color is melena, hematochezia, hemorrhoids, hematemesis. Correct answer is option B, hematochezia. So melena means it is not the fresh blood, it is the dark color blood, and hemorrhoids means piles. Hematemesis means the blood which is present in the vomitus. So the answer is hematochezia. Which cranial nerve is involved in the normal functioning of the GI tract? Option A is cranial nerve 2, option B cranial nerve 4, option C cranial nerve 8, option D cranial nerve 10. The correct answer is option D cranial nerve 10. It is vagus nerve. Next. Absorption of B12 take place in option A jejunum, option B stomach, option C ileum, option D large intestine. Correct answer is option C, ileum. Next, parotid gland opens into A. Wharton's duct, B. Rivinus duct, C. Stenson's duct, option D. Bartholin's duct. The correct answer is option C, Stenson duct. We have three salivary glands, parotid gland, submandibular gland and sublingual gland. So the parotid glands opens into the Stenson's duct, submandibular glands opens into the Wharton's duct and sublingual glands it opens into the group of Rivinus duct and ducts of Bartholin's. Invertogram is one of the diagnostic tests used in A. Pyloric stenosis, B. Intussusception, C. Anorectal anomalies, D. Diverticulitis. Option C. Anorectal anomaly. An invertogram may be used to investigate the extent of the defect in anal or rectal atresia. The anus is marked with a radiopaque marker and the baby inverted. A lateral radiograph is taken. The air in the rectum will rise to the highest point, giving an indication of the extent of atresia. So, the invertogram is used to detect anal or rectal atresia. Lactose intolerance is the inability to digest lactose due to insufficient amount of lactase enzyme. Where is the lactose usually found? A. Brush border of duodenum. B. Lumen of the small intestine. C. Lumen of the stomach. D. Lumen of the ileum. Answer is option A. Brush border of duodenum. Next question. The main action of ranitidine in treating in peptic ulcer disease. Option A. Increase gastric motility. Option B. Neutralizes gastric acidity. Option C. Inhibit gastric acid secretion. Option D. Increase histamine release. Correct answer is option C. Inhibit gastric acid secretion. Thank you for watching. Have a nice day.